One painkiller too many, and your kidneys, liver, or even life could be gone. Every day, millions of people take painkillers to feel better. But what most people do not realize is that these everyday pills are silently harming thousands and claiming their life. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu. I'm a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at some of the deadly mistakes that people make when taking painkillers. Why is this topic very critical? 1 in 4 people on a daily basis are using painkillers on a weekly basis. And over 100,000 people are rushed to the emergency department out of complications from painkiller use. These complications include vomiting blood, could be ruptured or perforated gastric ulcer, or even other complications of the kidney or the liver. And then most deaths, which are completely preventable, have been caused by painkillers. So they're not just drugs that we take to kill your pain. They can also kill you if you're not careful. So you should not have that trusted pill that you keep popping in at your leisure. It could be harming you, and we need to break this silence about the dangers of uncontrolled use of painkillers. So there are serious mistakes that people make with painkillers, and I want us to look at some of those. One is mixing painkillers with alcohol or other drugs. So there is this serious risk of damaging your liver when you take alcohol and you also take painkillers. Remember that alcohol is metabolized in the liver, and painkillers are also metabolized in the liver. When you take these together, this could mean overworking your liver and could mean serious damage to your liver. This could lead to increased sedation and overdose, especially if you have used opioids, a sedating drug. So 1 glass of wine with a painkiller could stop your heart. So please do not do this. The other mistake that people make is taking painkillers too frequently or too long. The long-term use of non-steroidal anti-inflammatory drugs. These are drugs like Brufen, diclofenac, and this can lead to serious damage to your stomach or your liver or your kidneys, leading to ulcers, which can make you start vomiting blood, or your ulcers can perforate, leading to life-threatening emergencies, or your kidneys can fail, and this can endanger your life. So, safe does not become dangerous. Safe can become dangerous when taken on a daily basis. So take caution. That pain pill to dull your pain could be what is going to damage your organs and leading them to shut down. So take caution and avoid this. Then using the wrong painkiller for the wrong pain. Sometimes we use painkillers for the wrong pain. For example, if you have a stomach pain, there is no law for non-steroidal anti-inflammatory drugs like Brufen or diclofenac. This is a pain from the gut, which has smooth muscles, and they do not respond to non-steroidal anti-inflammatory drugs. Pain of a toothache, avoid the strong opioids. Menstrual cramps, these do not need some of these sedating drugs. And when you use the drugs, like non-steroidal anti-inflammatory drugs, use them with food. This will help protect your stomach lining and protect you from getting ulcers. If you have joint pains, could there be another possibility before you grab that non-steroidal anti-inflammatory drug like diclofenac? So consider alternatives like drugs that you can apply locally, or consider things like heat therapy or even physiotherapy. You don't use petrol in a diesel car. So why should you use painkillers blindly? Be cautious. Then many times we take the painkillers without consulting the doctor or the pharmacist. And the over-the-counter drugs cannot be safe to everyone. Sometimes you may have conditions like asthma, or you have ulcers, and then you take over-the-counter non-steroidal anti-inflammatory drugs. Did you know that these drugs will be harming you more than sorting your problems? And children, elderly, people who have hypertension, and the expectant lady. These are high risk groups, and some of these drugs might be harming you or harming your family members. So, there are also some hidden interactions between drugs, especially like you're taking drugs for hypertension, diabetes, or even asthma. And non-steroidal anti-inflammatory drugs like brufen or diclofenac can be dangerous to people who have asthma, and they could worsen an asthma attack. So, what helps one patient could be dangerous to another one. So, let's not have a one size fits all to treat ourselves. Then, mistake number 5, ignoring the labels and the dosage instructions. Many times they will not even bother to look at the instructions for use, and this can lead to double dosing, especially if you're using drugs from different companies with multiple brand names. Taking drugs with an empty stomach, and I've talked about the non-steroidal anti-inflammatory drugs like brufen or diclofenac. When you use them with an empty stomach, they can erode your stomach lining and lead you to have ulcers, and sometimes you can have life-threatening complications. Then skipping the maximum daily dose of a drug. For example, if you take more than 4 grams of paracetamol, this drug is metabolized by the liver. If for any reason your liver is not working appropriately and you've overdosed it, then you are not reading the label, and this could put you at risk and damage your organs. And this could lead you to serious complications, and you may realize this when it is too late. So, what should you do when you are taking these pain medicines? Stick to the prescribed dose. 2, never mix painkillers without advice. And then ask the pharmacist for his help when you are not sure. And use natural alternatives when it is possible, and avoid unnecessary use of painkillers. So, when do you need to seek help? If you have this unusual fatigue, you see this yellowing of your eyes or your skin, then you need help. If you have black stools, that could be a sign that you're bleeding from somewhere. Persistent stomach pain could be a danger sign. The earlier you seek help when you have some of these signs, the higher your chances of survival and protecting yourself. So painkillers can heal or kill, and they can make your life comfortable or endanger it. So the choice is in your hands. So watch, share, and save a life today. Subscribe to the overall health YouTube channel for more real health talks that can save your life. Empower yourself, protect your family, and live smart. Thank you.